Hello everybody, Dr. Alex Vasquez here with the last video in our series on human microbiome and dysbiosis in clinical disease. Today I will cover part 2 of gut-brain connection and microbiome-mind interactions. Part 1, I discussed the introduction and some structural concepts. I'll review a few of those again today. We'll talk about some specific gut-brain mechanisms again in this conversation, which is mostly going to focus on clinical implications and interventions. Then I'll conclude with a quick summary of perhaps some of the more important concepts. For this section on the gut-brain axis, I have outlined the following teaching and learning objectives. First of all, of course, we always want to start with a survey of the literature so that we have a good understanding of the pathophysiology involved, especially for the conditions that I'm going to focus on, which are listed here. After that, the main focus of any continuing medical education is to change clinical action. So for that reason, of course, I'm going to focus on and discuss and review the evidence base for general interventions and, where appropriate, also very specific interventions. So the task today is actually quite large. I think that teaching and writing is generally pretty difficult. Good and excellent writing and teaching are even more difficult. And that is when we're talking about things that are well understood. So you can imagine the complexity of talking about things that aren't well understood, such as dysbiosis and neuroinflammation, and those, of course, will be the major topics for today. I've certainly done my due diligence in that I've read hundreds of articles on this topic, including essentially all of the major review papers. I'll talk about some of the better papers perhaps later in today's presentation. All of these have been published in leading journals, and not a single one of these articles has included all of the information that I'm going to cover today. As I state towards the bottom, the task of scientists is to discover facts and relationships. The task of intellectuals is to amalgamate all of that information into functional, comprehensible, and impactful models. To understand the role of neuroinflammation in dysbiosis-induced disease, one must first understand neuroinflammation. And then to understand, again, the role of neuroinflammation in dysbiosis-induced disease, one must understand dysbiosis. If you want to connect those two together, then I think we have the opportunity to gain some unique insights into common conditions, such as depression, anxiety, persistent pain, including, of course, fibromyalgia, chronic fatigue syndrome, and also complex regional pain syndrome. I'll talk about all of those today. So this is the second half of the gut-brain presentation. Let's talk about some of the main components of neuroinflammation. Now let's talk about autism, schizophrenia, and bipolar disorder. I'm sure many of you will find this to be a fascinating segment of this presentation. Moving our focus now to autism, let's look at some of the major modifiable factors, starting at the top and then moving in a clockwise manner. I think the key, foundational, and fundamental kind of cornerstone or keystone aspect of autism is the neuroinflammation and neurotoxicity. We also see very clear evidence of GI dysbiosis in autism. That dysbiosis, of course, leads to inflammagen exposure, also exacerbation of food allergies. We also see a role here for vaccinations, which are known to cause neuroinflammation, and also the dysbiotic induction of a pro-inflammatory immunophenotype. Patients with autism also show evidence of toxin exposure and accumulation, and at least part of that can be attributed back to gastrointestinal dysbiosis through the mechanism that I showed you previously, specifically that gastrointestinal dysbiosis leads to elaboration of excess endotoxin, and that endotoxin inhibits the cytochrome P450 detoxification pathway. Inhibition of that pathway would be expected to result in accumulation of xenobiotics that cannot be efficiently cleared. Those xenobiotics, of course, have neurotoxic effects as well as mitochondrial impairing effects. And that takes us to the fifth and final circle here of mitochondrial dysfunction. We know that mitochondrial dysfunction can be a consequence of inflammation and also a cause of inflammation, and that any type of neuroinflammation or neurotoxicity is going to be exacerbated by mitochondrial dysfunction. Let's take a quick look here at an excerpt from an article that I published in Integrative Medicine 2006 in April. This was actually an excerpt from a chapter that I wrote for the textbook of functional medicine, published by the Institute for Functional Medicine back in approximately 2005, was the first edition. What I stated then is actually true even now. We now know that autism is a multifaceted disorder associated with gastrointestinal inflammation, nutritional deficiencies, multiple food allergies and intolerances, impairments in liver detoxification, and a resultant accumulation of xenobiotics, the majority of which have either neurotoxic or immunotoxic effects. Thus, autism is not a behavioral disorder per se. Rather, it is a gastrointestinal, allergic, immunological, toxicant, nutritional, environmental disorder, and the behavioral cognitive abnormalities are symptoms of the underlying complex and interconnected pathophysiology. So, having summarized it as such, now I'd like to move forward and talk about a few more of the molecular details that we can focus in on, especially when we're dealing with autism.